Welcome to the deep dive. Today, we're diving into robotics and AI in European healthcare.
Oh, that's fascinating.
Yeah, and complex. You've got this academic paper. It breaks down all the legal and ethical challenges,
Envy?
especially when it comes to medical malpractice. And get this: by 2021, 42% of EU healthcare organizations were already using AI for diagnosis.
Wow.
So the question is, when a robot performs surgery or, AI helps make a diagnosis, who is responsible if something goes wrong?
That's the million-euro question, isn't it?
Yeah.
And this isn't just, sci-fi anymore. Robot-assisted surgery, AI diagnostics, it's happening all across Europe.
It's mind-blowing,
Yeah,
right?
really.
The paper even mentions the Lindbergh operation. A surgeon in the U.S. used robotic tools to operate on a patient in France,
Oh, wow.
over 14,000 kilometers away.
That's
I
incredible.
mean, think about how that could change access to healthcare. Imagine specialized surgeons doing complex procedures remotely, reaching patients like in rural areas or even disaster zones.
Absolutely. It could really democratize access to specialized care like we've never seen before.
Yeah.
And it's not just surgery. This paper shows how 28% of EU healthcare organizations were already using robotics in some way by 2021,
Okay.
with another 25% planning to adopt them. We're talking AI assisting radiologists, acting as virtual assistants for doctors, even helping with administrative tasks.
It's amazing how fast this field is moving.
Oh,
But what happens, when things go wrong?
right.
Say a robotic arm malfunctions during surgery,
Yeah.
or an AI misdiagnoses something serious.
Yeah.
Who's liable?
That's where things get legally murky. I mean, traditional malpractice cases, the lines of responsibility are usually clear.
Right.
But when you bring in robots and AI, well, it creates a whole new web of potential liability.
It's like a domino effect. You've got the doctor overseeing the procedure, the hospital that owns the equipment, the
Yeah.
manufacturer of the robot, even the software developers who made the AI. I mean, where do you even start to untangle that?
Well, the paper, it does a good job of breaking these layers down. For instance, could the doctor be held responsible if, let's say, they misused the robotic system
Yeah.
or misinterpreted the AI's output? What if the hospital didn't provide adequate training on the technology?
And then there's the manufacturer of the robot itself. If it malfunctions because of, like, a design flaw, they have to be responsible, right?
Right.
But what about the software? Could a bug in the code cause an AI to make a wrong diagnosis?
Exactly. And that's why the paper, it has this visual, figure one. It shows all the different players who could potentially be implicated in a malpractice case involving robots and AI. It's a lot to take in.
Yeah, it really is. And to make things even more complicated, there's this whole debate in the European Parliament about giving robots electronic person status,
Right.
basically recognizing them as like legal entities
Yeah.
responsible for their actions.
It's a fascinating, albeit controversial idea.
Yeah.
It raises so many questions about, well, accountability. Could an electronic person really be held accountable for, let's say, a medical error? And how would you even go about punishing or seeking damages from a robot?
Yeah, it's like we're going into uncharted territory here. Legally, ethically, I mean, if a robot is a person, does it have rights?
Hmm.
Could it even, like, refuse to perform a surgery if it disagreed with the doctor?
These are the kinds of questions experts are trying to figure out, and it's important to note there's pushback against this electronic personhood idea. The paper mentions an open letter signed by leading AI experts who argue that giving robots legal personhood is too risky.
So we've got this web of potential liability and then this idea of robots as electronic persons. It sounds like the legal side of things is about to get a lot more complicated.
It is, and this is just the beginning of our deep dive.
Okay.
Let's unpack another key concept: strict liability.
Strict liability. Okay. What does that even mean, with robots and AI in healthcare?
So it basically means someone can be held responsible for harm, even if they weren't directly negligent. Think of it like if a medical device malfunctions,
Hmm.
injures a patient,
Right.
the manufacturer could be held liable even if they, took all the right precautions when they designed and made it.
So how does that apply to AI systems, like in healthcare specifically?
Well, the AI liability directive, it proposes using this strict liability idea for AI systems too. So let's say a doctor uses an AI diagnostic tool
Okay.
and it makes a mistake, leads to, patient harm. The hospital or the doctor could be held liable even if they use the AI correctly.
Wait, so even if they did everything right, they could still be in trouble?
That's what a lot of healthcare professionals and legal experts are saying.
Yeah, I can see why they'd be worried.
They're concerned that this strict liability, it could make doctors and hospitals hesitant to use new AI,
Right.
even if it could really improve patient care.
It's like being penalized for trying to make things better.
Exactly. It's a tough balance, you know. On the one hand, you want to make sure patients are protected, that there's accountability if an AI system causes harm, but you don't want to stop innovation by, creating this environment of fear, legal uncertainty.
So how do we deal with all this? Is there a way to protect patients and encourage innovation at the same time?
That's the question, isn't it? The paper goes into this a lot. It shows how European regulators are trying to figure this all out. It points to different regulations and official reports that are shaping the legal landscape for AI in healthcare.
So they are paying attention to these challenges.
Oh, absolutely. The EU is actually seen as a leader in AI regulation. One example, you're probably familiar with the GDPR.
GDPR, yeah. That's about data privacy, right?
Exactly. And that's really important when it comes to AI and healthcare
Hmm.
because these systems, they use so much sensitive medical information. But beyond GDPR, there are lots of regulations, for medical devices and machinery that also apply to AI systems.
So there's a framework, but how do they keep up with how fast AI is changing?
Good point. It's a constant race, but the EU is working on a regulatory framework specifically for AI. For example, the European Commission, they issued a white paper on AI in 2020, proposed guidelines for ethical and sustainable AI development. And then in 2024, the European Parliament adopted the AI Act.
The AI Act, what's that about?
It's a big deal. It aims to regulate AI systems based on their risk level.
Risk level, so not all AI is treated the same.
Exactly. The AI Act recognizes that a chatbot, one that schedules appointments, is much less risky than an AI helping with surgery.
Yeah, that makes sense.
If something goes wrong, the impact is very different.
So how do they decide what's high-risk AI?
The AI Act, it has specific criteria. High-risk systems are those that could have serious consequences if they malfunction or are used improperly. This includes AI for diagnosis, treatment, surgery, also systems that could affect fundamental rights, like ones used to decide who gets social services or loan eligibility.
So for those high-risk systems, there are stricter rules to ensure safety and accountability.
Exactly. They need way more testing and certification. There's a big emphasis on transparency and human oversight. The AI Act requires clear documentation, disclosure, even data preservation.
That's good to hear. But what about the lower risk AI? Is there less oversight for them?
Not necessarily. The AI Act addresses those too, but the requirements are less strict. It's all about finding that balance, right? Encouraging innovation, but making sure things are safe.
Okay, so we have this risk-based approach. But what happens when those high-risk systems, DO, cause harm? Who takes responsibility then?
Well, to answer that, the European Parliament and the Council, they proposed the AI Liability Directive. And guess what one of the key concepts is?
Strict liability.
You got it. They're really trying to figure out how to hold someone accountable when an AI system causes harm, even if, there's no clear evidence of negligence.
But isn't that a slippery slope? If a doctor is using an approved AI system and follows all the rules, should they automatically be liable if something goes wrong?
It's complicated. There are good arguments on both sides. Some say someone has to be responsible for AI-caused harm, even if it's hard to say exactly where the fault lies. Patients deserve justice, compensation, when they're harmed.
What about the other side?
Others say strict liability could stifle innovation. Doctors, hospitals might not want to use new AI, even if it could help patients, because they're afraid of being held liable for something they can't control.
It's like trying to protect patients, but also encourage these new, potentially life-saving technologies.
Exactly. And that's where the paper has an interesting idea. It says we need a better way to decide liability in cases involving AI in medicine, one that goes beyond just saying high risk or low risk, and looks closer at how the AI is actually being used.
Okay, now I'm interested. Tell me more about this new approach.
So they suggest combining the but-for test, it's a traditional way of proving causation, with something called the covering law model, which considers, the scientific side of causation, like statistics and epidemiology.
Those sound pretty technical. Can you break it down a bit?
Sure. The but-for test, it basically asks, but for this action, would this harm have happened? It's about showing a direct link between an action and the harm.
So with AI, you'd ask, but for the AI's decision, would the patient have been harmed?
Exactly. But with AI, especially these complex algorithms, showing that direct link can be tough. We might not know exactly why an AI made a certain decision, and that's where the covering law model comes in. It adds another layer by looking at statistical probabilities, scientific laws, patterns in large data sets.
So it takes a wider view, considers the whole context, the different factors that might have led to the harm.
Exactly. It's about looking beyond just one cause and seeing that multiple things, including, the limitations and potential biases of the AI itself, might have played a part.
This is fascinating, but it also makes me realize how much we still don't know about AI in healthcare. It seems like we're just getting started.
We are, but that's what makes it so exciting. It's constantly changing with huge potential, but also a lot of
It
unknowns.
really feels like we're stepping into a whole new world, and we're only just starting to understand what it all means. So as we go deeper into this world of AI in healthcare, what are the big things we need to be watching for, like both as individuals and as a society?
Well, one really crucial thing is transparency.
Okay.
We need to know how these AI systems are making decisions, especially when it affects people's lives, maybe even life or death. This idea of black box algorithms where we don't know how they work, that's not okay in healthcare.
Yeah, I agree. Transparency is so important, especially when it's something as personal as our health. What else should we be thinking about?
Data privacy, it's a big one. I mean, these systems learn from huge amounts of patient data. So we need to make absolutely sure that data is being handled the right way, ethically. The GDPR is a good start, but we need to stay on top of it as AI keeps changing.
Right. And with all that data being used, how can we be sure that these AI systems aren't biased? I've heard about how bias can creep into algorithms, and then you get unfair or discriminatory results.
You're right, that's a huge concern. AI is only as good as the data it learns from. So if that data has bias in it because of, existing societal biases, the AI will pick that up too. It'll show up in its decisions. We have to be really, really careful how these systems are designed, how they're trained, to make sure they're fair for everyone, no matter their background.
So it's not just about the technology itself, it's about how humans are using it.
Exactly. AI is a tool. Just like any tool, it can be used in good ways or bad ways. It's up to all of us, developers, policymakers, doctors, patients, everyone, to make sure it's used ethically, responsibly, with the goal of making human health better.
This has been a really eye-opening conversation. Anything else you want to add before we wrap up our look at robotics and AI in healthcare?
I think the biggest thing to remember is that this is just the beginning. Things are changing so fast.
Yeah.
The AI we have now, it's just the start. As it gets more sophisticated, more independent, the ethical and legal challenges will just get tougher.
It is a bit overwhelming, isn't it? Like we're at the edge of this huge transformation in healthcare. And it's making us ask some big questions about what it means to be human, what it means to care for each other.
It is overwhelming, but it's also really exciting. And it's not just about finding the right answers, it's about asking the right questions. As AI becomes more common in healthcare, that line between humans and machines, it's going to get blurrier.
Mhm.
How will that change how we think about responsibility and accountability in medicine? That's something we all need to think about.
That's a great point to end on. It seems like this conversation is just the start of a much bigger conversation we need to have as a society about the role of AI in our lives. Thank you so much for taking us on this deep dive. It's been fascinating.
It was my pleasure. And to everyone listening, stay curious, stay informed, and keep asking those tough questions. The future of healthcare depends on it.